Thank you, Senator Cassidy. Senator Hassan.
Thank you very much, Mr. Chair and Ranking Member Cassidy, for this hearing. Mr. Bancel, thank you for being here. I want to follow up a little bit on what Senator Cassidy was just trying to get at. Moderna has said that its patient assistance program will provide low-cost and no-cost COVID-19 vaccines to the uninsured and underinsured. This program cannot simply be a public relations exercise that provides cover for the company to hike prices on families seeking COVID-19 vaccines. So how quickly after the launch of its patient assistance program will Moderna start providing publicly available data on the number of individuals it has covered and typical out-of-pocket costs under the program?
Thank you, Senator, for the question. We care deeply about patient access, and so I will work with the team to figure out what is the right frequency for sharing that data. But we want to find ways for people to get access to the vaccine.
Yes.
We still have 250 people dying every day of COVID in this country.
Yeah.
And we have a tool, so we want to make them available.
And I understand that Congress and the public is going to need information so that as you all proceed, if you are still planning to hike the price, that we can make sure that really the uninsured and underinsured are getting meaningful access to this in a timely way. Another piece of this is that uninsured individuals seeking COVID-19 vaccines are going to need to be able to access this program that you have, and they shouldn't have to fill out pages of forms with fine print in order to get access to your patient assistance program. So how long will the application for your program be, and how much documentation will you require from applicants?
Thank you, Senator. We've heard that feedback as we've talked to patients, to doctors, to members of Congress. And so the team is working diligently to figure out how do we use technology to make it simpler? How do we make sure we have access to enough languages so it's easy for people who are not, English as a first language? And also we're trying to be creative as we've done all over the history of a company. For example, are there partnerships we can do directly between Moderna and the rural hospital or community hospital in your state?
Yeah.
And of course, across the country.
Right.
Whereas we do a partnership, the doctors agree that they will certify that the people they give the vaccine that we'll send to them for free will be uninsured, so that individuals don't have to all do the form. So we're trying to figure out all those mechanisms to make it easier for people, including we're also working, for example, with homeless shelters for the same thing.
Okay, so I think that's really important. I think it's also going to be important that you all release the application for your patient assistance program before its launch so that the public can see what you're requiring from uninsured families. And just a note on the rural issue, one of the other things to be aware of course, is that a lot of rural communities don't have uniform access to high-speed internet, right? So we need to have processes that are meaningful for people who don't have that kind of access. I also just want to talk about the impact of the price increase on vaccine uptake. The fact remains that hiking prices and requiring families to fill out forms will likely decrease vaccine uptake and set back the public health effort to combat COVID-19. What are your plans to quantify and publicly disclose the consequences of your price hike for vaccine uptake among the uninsured and underinsured?
Thank you, Senator, for the question. So I will work with my team, and we are very happy to follow up with your office in terms of what will be our disclosure moving forward. The plan is still being worked on. What we want to make sure is that the plan is set up and announced way ahead of the vaccine availability in the fall so that somebody who is uninsured has access at the same time as somebody who is insured.
Well, I understand that, but I also think it's going to be really important for us to see what the uptake looks like in light of these increases, because I think all of us who have constituents, family and friends who deal with access to life-saving medications, every time there is some sort of bureaucratic hurdle, as well as every time there is a cost hurdle, there's an impact on uptake. So Moderna needs to kind of own its public health responsibility and disclose the effects of its price hikes so that the public and Congress can hold the company accountable if the price hike discourages millions of Americans from getting vaccines. And I know you want to work on that too, but we really are going to need data here. And I'm looking forward to seeing the company produce it. Thank you.
Thank you, Senator.
Thank you. Senator Markey.
Thank you, Mr. Chairman, very much. Welcome, sir. In the dark days of 2020, it was the partnership between the federal